The battleground in what is threatening to become a long-running and bitter dispute. Hospitals and patients across England bracing themselves for months of disruption unless a resolution can be found. But from the language being used by the Royal College of Nursing and the government, an immediate breakthrough is looking extremely unlikely.
Our nurses have rejected it. It's short-term measures. It plugs a gap, that's what they've said. And in fact, they've found that it was an insulting offer to put a bonus on the table and then take it off them again next year and find themselves back in a place where they can't pay their bills.
Health Secretary Steve Barclay has written to the RCN expressing his disappointment, emphasising Unison's acceptance of the offer. He said, "I'm also both disappointed and concerned that the Royal College of Nursing has chosen to announce 48 hours of continuous strike action without consultation of other Staff Council unions or waiting for the full Staff Council consultation to complete." He goes on to say the decision to refuse at this stage any exemptions for even the most urgent and life-threatening treatment during this action will, I fear, put patients at risk. The RCN says some parts of the offer, especially around staffing legislation and structure, are encouraging, but ultimately it wants more money for its nurses. The government says there is none available.
This is a very, very reasonable offer. It's fair to NHS workers, it's fair to other public sector workers, and it's fair to the taxpayer. Steve Barclay has said that his door is always open, so long as, in particular, there aren't sort of preconditions or strikes taking place. We are willing to talk.
This strike will be escalated. No derogations and, for the first time, no cover for intensive care.
There just aren't circumstances in which I'm going to sit on your programme and say I think it's right to remove cover for emergency care, for cancer care. I think that would be the wrong thing to do.
And that urgency becomes more acute with the possibility of coordinated strike action between junior doctors and nurses. I've just been speaking to the CEO of a large NHS hospital trust, and he told me that any coordinated action between junior doctors and nurses would effectively shut his hospital down. He wouldn't be able to offer any patient services except perhaps keep open the doors to his emergency department. But he went on to say he didn't think it would come to this because all sides involved in this dispute know exactly what sort of impact any coordinated action would have on patients. He said it was the ultimate threat. A threat everyone hopes can be averted and this conflict finally settled. Ashish Joshi, Sky News.